digestive disorder. Diarrhea causes frequent loose and watery bowel movement. Several things can bring it on, such as infections, dietary choices, and underlying medical conditions. While diarrhea is typically transient, it can still be unpleasant and upsetting. Now, this podcast episode covers the causes, precautions, and the practical management techniques for diarrhea to help you know what to do when you have it. I am Dr. Agnes, and welcome to Talk with Dr. Agnes. Now, let's dive into the causes of diarrhea, and they include number one, infections with bacteria, viruses, or parasites. They are frequently to blame for severe diarrhea. Now, these diseases can be caused by contaminated food or water, inadequate hygiene, or all three of them. Okay. Now, secondly is dietary factors. Eating too many foods, particularly those with a lot of fiber or artificial sweeteners, might cause diarrhea. Thirdly, diarrhea can also be brought on by food intolerances or allergies, such as lactose intolerance or celiac disease. Number four is some medications, especially antibiotics, might upset the average balance of intestinal flora, which can have the side effects of diarrhea. Persistent diarrhea may be a symptom of long-term illnesses such as malabsorption disorders, inflammatory bowel disease, or irritable bowel syndrome known as IBS. It's frequently more beneficial to prevent diarrhea than to treat it once it has started. Now, here are some of the preventative measures that you could implement. One is hand hygiene. Washing your hands frequently with soap and water can help lower the risk of infection-related diarrhea, especially before eating or after using the restroom. Secondly, to reduce the risk of foodborne infections, ensure food is adequately prepared, cooked, and stored. Eggs, meat, and seafood should not be eaten uncooked or undercooked. All right. Thirdly, to avoid waterborne diseases while traveling or in locations with uncertain water quality, use bottled water or purified tap water. Okay. In terms of dietary options, consider nutritional choices carefully. Eat less high fiber, spicy, or oily meals that might cause diarrhea, especially if you have a history of food sensitivities. All right. If giving antibiotics, think about taking probiotics to maintain a healthy gut flora balance. All right. Obtain advice from your healthcare professional regarding possible side effects. All right. Now, what are the treatment options for diarrhea? It is crucial to act appropriately to treat the illness and ease symptoms when diarrhea develops. Remain hydrated because the fluid loss from diarrhea might result in dehydration. All right. To stay hydrated, consume clear broths, electrolyte-rich liquids, and water. Follow the BRAT diet, BRAT, which consists of bananas, rice, applesauce, and toast to help your stools firm and relieve digestive discomfort. Now, the BRAT diet is a low-fiber, gentle food plan for treating stomach problems. Although it may be advantageous in the short term, extended use could have negative effects. It's vital to remember that brat diet is no longer indicated for infants, and that instead it's advised to nurse or give infants full strength formula when they are recovering, and provide them with a balanced meal. All right. When faced with stomach problems, it's often better to choose the brat diet for adults and children than to completely abstain from meals. But it's also important to understand that there are better long-term eating plans than the brat diet, okay? So even if diarrhea continues, the ultimate goal should be to quickly return to a regular diet to reduce the risk of malnutrition. All right. A more recent study is required to determine whether the brat diet is still an effective treatment for those with digestive problems. Steer clear of substances like caffeine, alcohol, and high-fat food that can make diarrhea worse. Diarrhea symptoms can be lessened using over-the-counter anti-diarrhea drugs such as loperamide, which we call Imodium. Use this only as doctor directs, especially if you have an illness. All right, get lots of rest to give your body time to recover, and don't engage in demanding tasks until your symptoms go away. Seek immediate medical assistance if diarrhea lasts for more than a few days, and it's accompanied by severe abdominal pain, fever, or blood in the stool, or if you suspect an underlying medical disease. In conclusion, diarrhea is a typical gastrointestinal condition that can be uncomfortable and cause disruption in activity and daily living. A speedy recovery depends on identifying its origins, taking preventative action, and implementing sound management techniques. All right. People can lower their chance of developing diarrhea and lessen its effects by practicing good hand hygiene and eating a well-balanced diet and staying hydrated. When in doubt, seek a healthcare professional's advice and treatment choices. All right. I hope today's episode was both informative and engaging. Please contribute your views and observations in the comment section below, as we value them very much. Follow Talk with Dr. Agnes on Facebook, LinkedIn, Spotify, TikTok, and Instagram to stay up to date, and subscribe to my YouTube channel. All right. You should be promptly notified anytime new content is published, or by doing so. All right. Now, if you thought this information was helpful, consider sharing this video with your loved one, so that we convey knowledge and encourage one another by improving our general well-being. All right. Please contact us via email talkwithdragnes.com if you have any questions about our web series or potential partnership with themes for health promotion. All right. Until our paths cross again, keep working towards being the healthiest and the best self, and I will talk to you soon.